When a patient asks, "Doctor, can my diabetes be treated?" what they're really asking is, "Can I ever get back to normal?" Just like how an antibiotic cures an infection or a plaster heals a broken bone, they hope that diabetes too can be fixed. You come home thinking, "Diabetes runs in my family. Now it's my turn." You accept it, you take the medicine sincerely, just like millions of other Indians. But here is the truth. Clinical data shows nearly 74% of diabetics in India still have uncontrolled blood sugars, even with medication. And that leads to serious complications like heart disease, kidney damage, vision loss, nerve damage, and even erectile dysfunction. The good news? You can change this, but you have to take action starting today. Hello, this is Trilok. I'm a dietitian. Do you know that 74% of diabetics in India have uncontrolled sugars even while on treatment? That means whatever we are doing to manage diabetes is not working. In today's video, I'll walk you through 3 powerful concepts that can help you whether you have early stage, long term, autoimmune, or even type 1 diabetes. The first concept is called gastric emptying. What is it? It's the amount of time it takes for food to leave the stomach. Once the stomach empties, it releases a hormone called ghrelin, the hunger signal. So if you can delay gastric emptying, you feel full for longer and food enters the small intestine gradually. This helps you with slower glucose release, better blood sugar control, and less insulin spiking. That's why many modern diabetes and weight loss medications like GLP-1 agonists are designed to slow down gastric emptying. But here is the best part. You can do this naturally just by changing your food composition. Let me explain. Let's say you ate 4 idlis on an empty stomach. They digest quickly, release blood sugar fast, leading to insulin spikes. But if you eat a salad before the meal, the digestion slows down. This effect is demonstrated in a study by Dr. Alexander Jenkins and colleagues. They showed that adding viscous fiber before carbs reduced post-meal glucose spikes by 30 to 40%, which is significant. And when you combine fiber with protein, the gastric emptying further slows down and keeps your blood sugars stable. Your pre-meal salad could be as simple as 40 grams cucumber, 30 grams carrot, 20 grams tomatoes, 10 grams beetroot, and 50 grams of boiled sprouts. The second concept is the glycemic index. It is a number assigned to a food based on how quickly they can rise blood sugar levels. Pure glucose is used as the reference, and it has a GI of 100. White rice, white bread, and instant oats have a high GI of around 75, meaning they rise blood sugar quickly. In contrast, brown rice, whole wheat, and steel cut oats have a GI of 55 or lower. To simplify, foods are categorized like this. GI less than or equal to 55 is considered low GI. GI more than or equal to 70 is considered high GI. Anything in between is considered moderate GI. Here are a few examples. Brown rice has a lower GI compared to white rice. Whole wheat has a lower GI, but once it's refined into maida, the GI increases sharply. Whole fruits always have a lower GI compared to fruit juices. And steel cut oats are low GI while instant oats are high GI. Here is a quick comparison chart between low GI and high GI foods. You can find longer lists of food GIs online, but this gives you the big picture. So what does the research say? A meta-analysis published in the journal Diabetes Care, which reviewed 14 randomized controlled trials, showed that people who followed low GI diets saw their HbA1c drop by about 0.43 percentage points on average. That's a clinically meaningful improvement just by changing food choices. So the takeaway is choose low GI foods whenever possible and limit high GI foods to small portions or pair them with fiber and protein. The best thing to do is have fiber and protein first, followed by low GI foods. Now we move on to the third concept, which is more important than glycemic index. That is glycemic load. It is the total amount of glucose released by a portion of food. If you keep consuming the same amount of carbohydrates, even with added fiber and low GI choices, your body will end up absorbing the same amount of total glucose. This can cancel out the benefits of delayed gastric emptying and choosing low GI foods. Let me explain. Take watermelon for example. It has a high glycemic index of 72, but it has only about 6 grams of sugar per 100 grams. Now compare that with brown rice or rolled oats. They have a lower GI but contain 45 to 50 grams of carbs per 100 grams. So low GI doesn't always mean blood sugar safe, because your portion size determines the glycemic load. In a 2016 interventional study, patients with poorly controlled type 2 diabetes followed a diet low in glycemic load. The result? HbA1c dropped from an average of 8.8% to 7.8%. So when you combine slower gastric emptying with low glycemic load foods, you feel full for longer, naturally eat fewer carbohydrates, and reduce the total sugar entering the blood. And finally, when you combine these three concepts with exercise, you can reach your ideal weight, reduce visceral fat, and more importantly, begin reversing insulin resistance and maintain these in long term. For most people, weight loss is about 70% diet and 30% exercise. Why? Because it is easier to avoid 300 calories by skipping a samosa or a burger than to burn 300 calories through an hour of walking. That's why most people focus only on diet and neglect exercise. But let me explain it to you why exercise is super important. Inside every cell in your body, there are tiny engines called mitochondria, which burn glucose to produce energy. In sedentary individuals, a muscle cell may have only 200 to 300 mitochondria. But in people who exercise regularly, that number can rise to 800 to 1000 or more. That's because in biology, use it or lose it is real. Anything that isn't used is metabolically expensive and eventually downregulated. So when you exercise regularly, you maintain a higher number of mitochondria, which means you burn more calories at rest, you have more energy, your heart and lungs become more efficient, and your insulin sensitivity improves. So please don't skip exercise. Here is what to aim for: 40 to 60 minutes of cardio, walking, cycling, or treadmill, and 20 to 30 minutes of strength training, dumbbells, resistance bands, or bodyweight exercises, at least 5 days a week. And lastly, check your HbA1c every 3 to 6 months and keep your doctor informed, because as your diet and lifestyle improves, you may need less medication. Always remember, the sooner you start, the better your outcome. If you like this video, give it a like, share it with somebody who needs this, and subscribe for more evidence-based health videos. Thank you for watching Nutritional Perspective. I'll see you in the next video.